to the Board of Health for November the 30th, 2020. Just a couple of sort of housekeeping reminders. Anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating via phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. And please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. I'm now going to ask the Board Secretary to please conduct the roll call.
Member Banham? Member Cloutier?
Présent.
Vice Chair DiGiovanni?
Present.
Chair Eglai?
Here.
Member El-Shantiri?
Present.
Member Gower?
Présent.
Member Kavanaugh?
Present.
Member Lincoln?
Present.
Member Menard?
Hi, everyone.
Member Pinel?
Présent.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. A few more housekeeping reminders. So the following procedural guidelines are being implemented to promote orderly proceedings of this virtual meeting. Attendance: should any members need to leave the meeting, they should advise verbally that they are doing so before clicking on leave meeting from the Zoom platform or ending their call if participating by phone. In terms of speaking order, I'll provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order set out in the Board Secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on any given matter, you may decline verbally when your name is called. For voting purposes, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all votes are properly registered. For points of order, privilege, or challenge, procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you've been not called upon to speak, please state your name aloud for the record before stating your point of order. Recess. Should technical difficulties or other unforeseen matters require a recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. I'm now going to ask for any declarations of interest, and I'll turn first to Member Lakin.
Thank you, Chair. I, Member Lewis Lakin, declare a deemed pecuniary interest on Ottawa Board of Health Agenda 14, Item 4, 2021 Draft Operating Budget for the Ottawa Board of Health, Document 1, page 5, Ministry of Health Long-Term Care Programs and Standards, COVID-19, Base Shared Costs, Shared Core Programs, 100% City Programs, and COVID-19 one time as a family member is an Ottawa Public Health employee working in these areas.
Thank you, Member Lakin. I will now read out my declaration of interest. I, Chair Keith Eggle, I declare a potential deemed pecuniary interest on Ottawa Board of Health Agenda 14, Item 4-2021 Draft Operating Budget for the Ottawa Board of Health, Document 1, page 5, Ministry of Health and Long-Term Care Programs and Standards, 100% City Programs, as I'm on the Board of Directors of the Youth Services Bureau, an organization that will receive funding from or would be eligible to receive funding from this budget line item. Can we please confirm the minutes of the meeting of November the 2nd, 2020? Carried?
Carried.
Thank you.
Carried.
We have 4 communication items have been received and are held on file with Board Secretary. Can we receive the communications as noted in the agenda?
Received.
Thank you.
Received.
I'm going to call upon Member El Shantiri, who will move the motion to introduce reports, including suspension of the rules to consider the additional item, AMOH appointment.
Thank you, Mr. Chair. Be it resolved that the presentation on the City of Ottawa draft official plan, the Chair of the Board of Health verbal report, the Medical Officer Health verbal report, and the report's title 2021 Draft Operating Budget for the Ottawa Board of Health update the next step on COVID-19 response on Ontario Public Health Standard 2020 Activities Report Risk Management be received and considered, and be a further resolve that the rule of procedure be suspended to receive and consider the report title Appointment of an Associate Medical Officer of Health in camera personal matters about identifiable individual reporting outdated upon council approval.
Thank you, Member El Shantiri. Can we carry the procedural motion, please?
Carried.
Thank you.
Carried.
I'm now going to go through our usual consent agenda process. For those participating from home or watching from home who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns and we don't have public delegations registered to speak, the board may carry or receive those items on consent, which is to say, without any discussion. So starting with the first item, presentation on the City of Ottawa's draft official plan. Mr. Stephen Willis, the General Manager, will be making a presentation. So we'll hold that item. Next is my verbal report. So we'll hold that, followed by Dr. Etch's verbal report. We'll hold that. Next is the 2021 draft operating budget for the Ottawa Board of Health. We have a brief presentation. We have a public delegation, and so we will hold that item as well. Next is an update and next steps on COVID-19 response. And while we don't have a presentation for that particular matter, we do have a public delegation. So we will hold that item. Next is the Ontario Public Health Standards 2020 activity reports, risk management. Can we receive that on consent?
Received.
Thank you. Next is the additional item, which is the appointment of an Associate Medical Officer Health. If we need to discuss it, we need to go in camera on this because it's a personal matter about an identifiable individual. But we can carry it on consent. You all received a copy of this report, and if you like, we can carry it on consent. Carried? Okay. Next is information previously distributed, the Community Safety and Wellbeing Plan interim report. Can we receive this information?
Chair Eglai, I have a question about the medical officer's health and involvement in the police board, and I'm wondering if now is the time to ask that, or if I could ask it in a different report. If now is the time, I can ask it, but
I'm sorry, Member Menard, you're saying you had a question about the Board of Health's role in the police board?
well, within the consultations that are planned, and they're related to the community safety well-being plan, and that's why I wonder if now's the time to ask the question, or I could do it in an early, when the report happens.
Well, I think if it's a brief question, Member Menard, I don't see why we couldn't do it now.
Okay, great. And it is very brief. And so I guess just to the medical officer of health, my understanding from Mr. Steve Bell and others is that public health has been involved in a discussion around the forthcoming consultations on policing in Ottawa. And I just wonder to what extent public health has contributed and any information you may want to share with the board.
Yes, thank you. Certainly, we have a team that focuses on mental health and substance use, and we have this as one of our strategic priorities for our whole organization. And so the lead for that team has been a resource to the Ottawa Police Service in identifying sources of information and existing networks to inform the development of a new approach to crisis intervention when police are involved and it's a mental health crisis. And so I'm proud of the team that has been able to foster connections and support a consultation that would draw on the experience of community members and our mental health service provider partners, and point to some of the data that we have as well about the needs in our community. We have been part of the discussions as well about how to advance the mental health and substance use priority under the Community Safety and Wellbeing Plan that also is of interest, and part of the perspective of the police is that work can grow under that priority. And so we continue to be in joint conversations about that.
Okay, great. Thanks very much, Chair. Back to you.
Thank you. So can we receive the information report now?
Received.
See, thank you very much. So we will go back then. We've held most of the items. So we'll go back then to the first item that we held, which is a presentation on the City of Ottawa's draft official plan. I believe we have Steve Willis on the call. Yes, we do. There's Steve. Welcome. I'll leave Steve to go through the PowerPoint presentation, and then Steve, you'll take some questions. Perfect. All right, I'll turn it over to you then.
The opportunity to make this presentation today. I just want to confirm that I will be making the presentation in conjunction with Emily Davies, who's part of the official plan team. So Emily will deliver some slides and I will deliver some of the others. And I should say that I know that Alain Miguelez, who is the manager of policy planning, has presented to your group in the past. He regrets he couldn't be here tonight. I'm actually the understudy because this is actually Alain's project but I'm here to present tonight on behalf of the official plan team with Emily. This is a check-in update to you and really to let you know that our first draft of the policies are actually on the street now for public consultation, and we're hoping this is an opportunity for people to learn more, that it's on the street, and provide us some feedback. Before I actually begin, I want to go back to a conversation I had in the early days. Dr. Etches and I both started our jobs relatively around the same time, not exactly the same time, but we were both newbies, I would say. And this whole partnership that I'm going to talk about began over a coffee, where we were talking about how we could make public health a greater priority in community planning in the city as we go forward. We certainly have seen this as a growing evidence of the link between urban form and public health, and we wanted to make this a priority in the plan. So I thank Dr. Etches, because this has been a true partnership right from the very beginning. We both wanted to do this, and Ottawa Public Health has certainly supported us. So if we go to the next slide, please. So one of the things that Dr. Etches generously did was, right from the beginning, in terms of making this a real partnership, not just a consultative process with each other, Dr. Etches embedded 2 Ottawa Public Health staff in the official plan team. They worked side by side, and they contributed to the development of discussion papers and for policy. And they have continued to provide us advice in these drafts as we've gone forward. And that is new. I have not found another example in Canada yet where we've actually had a public health group actually embedded in the writing of an official plan. So I believe we've done something brand new here. And I want to thank Inga and Birgit directly they provide very, very thoughtful advice and made major contributions to the draft that's out before you today. So their work contributed right from the beginning in a precursor document we called Ottawa Next, and I believe Alain presented to you about this, and also in a discussion paper called The Building Blocks for a Healthy Ottawa. They also helped us form the 5 big moves, where we talked about embedding public health and environmental, climate, and energy resiliency into the framework of our planning policies, and really expanding on that in our preliminary policy directives. We go to the next slide, please. So in the draft new official plan, there is a section in the document called Healthy and Inclusive Communities, which lays out the policy intent statements related to health in this official plan. And we worked with the leads of the other components of the official plan to have an integration. So it's not just on its own and standalone. And it's a really important part of delivering on the promise of trying to bring official public health considerations into the official plan. If we go to the next page, if you have a chance to look at the official plan summary documents, the document itself is about that thick, so it is a heavy document to make your way through. But we've created 2 one-page summaries on what we think are the most topical official plan topics related to public health. One is on healthy and inclusive communities, which talks about what we did in the official plan to address it. And because the topic came up so much about what's the impact of the pandemic on long-range planning, we prepared a special one-pager on that as well to help people understand how that's playing out in the official plan. And we have tailored feedback on the city's Engage Ottawa site on both of these topics if people want to provide us feedback specifically to those. At this point, I'm going to turn over to Emily, who will deliver the next slides.
Thank you so much, Steve. So I'm really happy to be here and be a part of this presentation. I'm going to give a very high-level overview of the thick document that Steve just spoke about, which is the official plan, in order to give you a little bit of a flavor and a taste of what the official plan document really talks about. So the official plan document contains a couple of different volumes. The first volume of the official plan contains the broad, higher level overarching policies for the entire city of Ottawa, and that's volume 1. Gets into issues like mobility and neighborhoods, density targets, and paints the picture for how Ottawa will grow over the next few decades for the city in its entirety. Volume 2 of the official plan then contains more nitty-gritty type policies getting into neighborhood type development, and those are called secondary plans. The secondary plans are divided into urban and rural secondary plans and provides direction for growth within neighborhoods. The official plan is also accompanied by over 100 different schedules, and those provide the mapping details of what is included on the actual ground. So one can get a look of, for example, where the transects lie, where the different land use designations apply, and get a flavor from that sense. Next slide, please. There is a bunch of different policy directives that are similar in approach to the existing official plan, and we've carried it over into the new official plan. For example, in the existing official plan, we plan around what we call mixed-use centers and main streets. That philosophy still applies in the new official plan as we're planning around hubs and corridors. The new official plan also continues the approach with polycentric city with a strong central downtown core and focusing development in the downtown core, for example, employment and high-rise development. The existing official plan also has a lot of details around neighborhoods and focusing on development within neighborhoods. Next slide, please. One of the biggest questions that we get as part of the presentations for the new official plan is what is different in this official plan? When you pick up the actual document, you'll see much is different. It has a complete new look and feel, but primarily one of the core central pieces is that we're no longer planning around land use, we're planning by form and function. And that's really important in order to achieve and support the 15-minute neighborhood concept, integrating land uses so that people can walk to different land uses in their community, and supporting a lot of the health objectives that you see in the official plan. I just wanted to make a quick note that if you do have time to pick up the document, you'll see that there is a health icon in the official plan. It's a heart, and that heart symbolizes all the different healthy policies that are integrated throughout the plan. And I'll pass it back to Steve, who's going to talk about next steps with our process.
You're
on
on.
the next slide, please. So through 2020, we've done consultations on growth management. We presented the idea of 15-minute neighborhoods, which has taken the community by storm, I'd say, because what we've seen, particularly with the pandemic, is that how important 15-minute neighborhoods have become. It's actually shone a spotlight on what this actually means. And we've had lots of discussions on transect area goals with many stakeholder groups. The draft official plan is on the street now for consultation, and we are getting public feedback on that over the next couple of months, and then we will do a series of revisions to the document, and ultimately council will be asked to adopt it in the fall of next year. So in terms of people's opportunity to stay engaged, first of all, if we haven't already done this, and I don't know if my staff worked with the board's coordinator, that those two backgrounder pages that I referred to earlier will be provided to you. We can arrange for that to be done. We want people to stay engaged. The whole official plan is on the city's website, and there are many ways to provide input back to us, either through surveys or through direct letters to the official plan team. And at this stage of the game, we want to get some validation that we're on the right track and that people are seeing what they'd hope to see, and maybe have some suggestions about even ways to improve it as well. So that's our presentation, Chair, and we're happy to take any questions.
Well, thank you very much, Steve and Emily, for the presentation. And Steve, also thank you for allowing public health a seat at the planning table as the city moves forward. I think, you know, that was very forward thinking of both yourself and Dr. Etches. There's I think, a natural synergy there. As we grow our city, we want to grow it as healthy as we can. And so, you know, again, thank you very much for the opportunity to be part of this very much city building project. I'm going to go through the list of board members. If you have any questions, this is your opportunity. We'll start with Member Banham. Sorry, you were muted. I didn't hear you. Still muted. I'm taking you have no questions.
Chair, actually,
you are unmuted, but you're just very fuzzy. but you are unmuted. It's just you can't really hear you. You're still fuzzy, very low volume.
But I think we've established no questions. So, Member Kuche.
Thank you, Chair. Thank you, Mr. Willis and Emily and your entire team and Alain for your work on the official plan. Generally, as a city building exercise, and certainly with its focus on public health. Wanted to know how, and I appreciated the position paper that was put out about a year ago, approximately, and with respect and with its focus on public health and with its focus on the elements of public health of land use and transportation as it relates to contaminants and climate change and crime and all of those elements that impact the health of our community. How has the focus in this official plan, and if you could remind us when the official plan was last changed, if you could remind members of the board, when the full official plan was last changed, how's the focus on health different in this iteration of the official plan versus previous iterations of official plans?
The last official plan effectively was a document that was adopted just post-amalgamation, almost 20 years ago, in 2003, and has been amended a number of times to introduce some new policies related to intensification. But it never, although it had language about healthy communities, never had explicit policies that one could tie very specifically to public health. And we're now talking about, you know, valorizing the active transportation policies we've had about what that means towards public health. We've talked about the configurations of green spaces and public spaces and parks to create more active movement areas for people who aren't necessarily playing sports. We talked about heat islands. We talked about food deserts. You know, we're into new territory that we hadn't previously had policy objectives very clearly on. And Emily may wish to add to this because she's closer to the document than I am. But you know, the point is we've put it out front that health is a very important issue. And the whole concept of 15-minute neighborhoods, and if you think about how these things interplay, really would allow us to have a much healthier lifestyle than what we've been building in the past.
Thank you. Did you use any policy initiatives that you may have found elsewhere in the world? And have they been incorporated? And could you give us some examples of how successful those have been as an official plan in those areas have moved to implementation, of course, as it relates to health and well-being of our residents?
I don't know if the OPH's own staff are actually on the line because they actually wrote these policies. So if Birgit or Inga were actually on the line, I welcome them to speak for their own work. I'm not sure. But,
I do believe Inga is on the line.
Inga, then why don't I'd like Inga to take credit for the work they've done because again, Birgit, because this is new. We've never seen this done before where public health staff actually wrote policies. So I'd like to give them credit for their own work, if you don't mind, Chair.
Hi there, folks. Sorry, my video cut off just exactly as you said, pan over to Inga. So I hope I didn't miss part of the question, but certainly the building blocks for a healthy Ottawa provided us with a great opportunity to delve into the research and best practices. And, you know, as is best practice for public health, we look to the evidence base to guide us when we make recommendations. And to other policy examples throughout other jurisdictions. So yeah, it was informed by evidence, informed by best practice, and it does seek to kind of elevate those issues, bring them to the forefront, and ensure that they're integrated with the other policies such as mobility, active transportation, protection of natural green spaces, etc.
Thank you very much.
If I may, Chair, Inga is being very modest. She has broken new ground here with bringing the evidence together and recommending a 15-minute neighborhood approach, along with others on the team, Birgit, and you know, we have had different people contribute over time, but it's really been actually new territory building on the evidence.
Thank you, Dr. Etches. And yes, thank you, Inga. And you had seen me in my office many months ago, well over a year ago, certainly, with respect to this. And I sure did appreciate your perspective. I think Inga is a planner by trade, aren't you? And now with OPH, and it's a great fit. So active transportation. I won't take up too much time, Chair. Active transportation are the obvious issues, but I think in terms of public health and mental health and food security, community gardens, social spaces, perhaps envisioning certain cultural elements in a planning context that might lead to a better sense of community, a sense of socialization, a sense of afternoons for our people, and how that leads to better mental health, I think are all important issues that we might find threads in the implementation of the official plan. So I hope that those policy nuggets are there as we develop and as we approve the official plan. I have no question associated with that comment, but I just put that out for consideration in a health context. Thank you for your work on the official plan to the whole team.
Thank you, Member Puche. Vice Chair, any questions?
No questions on my part. Thank you.
Thank you. Member Santé.
Thank you, Mr. Chair. And I'd just like to echo our team when they talk about the 15-minute neighborhood walk. I think we had benefit from by having one of the village, which is very unusual to include as a part of the 15-minute neighborhood walk. And I just want to see the experience itself and what we learned from it. We'd be able to implement it in the new official plan and focus on that area, because it's not just in the urban and suburban, also in the villages. The 15-minute walkable community become very beneficial to us.
Thank you. Member Gower.
Yes, just a quick comment. I guess in the same way that we've all been listening to the advice of Dr. Etches and her team at Ottawa Public Health as it relates to COVID-19, I guess I would hope that we do the same as it relates to their advice for the official plan. The importance of 15-minute neighborhoods, of green and sustainable communities, and of neighborhoods for everyone. And I hope that advice doesn't get eroded as we go through some of the policy and politics of it over the next year as we finalize the plan. Thank you, Mr. Chair.
Thank you. Member Kavanaugh.
Thank you very much. It was last year. Oh gosh, feels like longer ago. I went to a conference called Healthy Cities, and it was in Portland, Oregon. And when I came back, it was OPH who wanted to debrief with me about it, because it was a natural to find out what was being talked about with Healthy Cities, and I appreciated that. As well, when I wanted to work with OPH, I wanted to do a bike tour of the ward, they were happy to come with me, which was great, so they could see it from the bike perspective. So I appreciate that. I'd like to know, what do they feel is their signature contribution to the official plan? What they feel most proud of? Because I can't see, the OPH and the official plan, to me, have to go together. I saw that with other cities that went to that conference, that they sent public health people to that conference on Healthy Cities to work on official plans. So, but I'd like to know what we consider to be the strongest emphasis.
Well, I will begin, and if you're asking for the public health view, with a thank you also to Mr. Willis and team for the inclusion for this vision that's shared. I think the inclusion of healthy and inclusive communities as a strategic direction overarching is really key. So that that language to begin with, that objective is really important. I don't think the word healthy communities, I don't think that was a vision before in the plan. So that's important. And then it comes down through different policies. As the councillors know, there's a lot more that's going to happen to get from the vision into implementation. And I'm really pleased that the partnership's been established to continue that work, and that there are some new tools that have potentially been advanced. So I'm not sure if Inga wants to speak to any more of the specifics, but certainly I think the foundation is there to continue this work together.
Inga?
Okay, thank you very much. Inga, you want to add to that?
I was just going to agree, but I think one of the things that that excites me the most as a planner working in public health, I must say, is the engagement with the official plan team in the planning department. It really has been such a wonderful experience to have such meaningful dialogue with our colleagues in other city departments on how we can grow as a city and grow to be healthy and inclusive. So, thank you.
Okay, thank you.
Thank you. Member Lakin.
Thanks, Chair. Two things. First, want to echo your thanks to Dr. Riches and to Steve Willis for really just enabling the health to be at the planning table. It's marvelous. It's the second time as a member of the board that we've heard someone from planning address us, and it's a fantastic step forward. I might be getting a bit ahead of myself in the question, but since health is a new member at the planning table, I know there are structures and procedures in place to translate the plan on matters like land use and new developments. Are there any structures or organizational steps that need to occur in order to translate these wonderful health-related concepts into reality?
At this stage of the game, we have been thinking ahead to the next steps, and in the official plan, which will lead to an update of the zoning bylaw, some of the matters will get carried through the zoning bylaw. But zoning in Ontario, the way the province has set the legislation, is a very, very narrow toolbox. It allows us to control a number of parameters, but not everything. A lot of the other elements will come through various design guidelines and best practice documents that we would produce. And certainly I could see a role for Ottawa Public Health and future urban design guidelines development and other parts. And Dr. Etches and I have to work with each other to find out a reasonable balance of the demand I'm putting on the OPH system to provide that type of input and advice. But we have outstanding people in the OPH team to give us that advice. And I see it being translated in through those further steps. And then we implement those through the various other approvals the city would give at different points in time.
Great, thank you, it's helpful.
Any other questions, Member Lakin, or does that cover that off?
Yeah, that's great. Just wanted to understand how it was going to go from theory to practice. That's helpful. Thanks.
Okay, thank you. Member Menard.
Thank you very much, Chair. Thank you for the report. Sorry if my internet's a bit unstable here. I'm coming through okay. I have a few comments. I mean, first of all, I feel very proud about the work OPH has done here and the staff team that working in conjunction with our planning staff. So thank you to them. I have to just pass along an anecdote, and I was on an Ecology Ottawa online gala this week over the weekend. And there was repeated praise for OPH in the chat about the policies they've advanced, not just during the pandemic, but beforehand as well, and through the official plan. So I think there's widespread support for the OPH-based advice that's been given and taken by staff. So thank you for that. I do have a few questions about the report and the briefing note. One of the lines in there talks about reconceptualizing how new communities grow and how to better establish commercial amenities and services to support active transportation. I'm just wondering if staff can expand on that. What do we mean by establishing commercial entities and services to support active transportation?
I can start, and Inga may wish to add to what I have to say, and even Emily may have a point on this. I mean, one of the things we have in some of our newer communities traditionally is very You know, if you early post-war, we had a lot of smaller retail to support a large population that was close by that people could walk to and perhaps bike to. And then we seem to move away from that to everything being entirely car dependent. And there will always be certain land uses that are highly car dependent, but we want to grind back to what we were before, where much more was very accessible. And we're very concerned about food accessibility in this, because there are too many areas where you have no choice but to get in a car to actually buy food. And that's where the system starts breaking down at that very, very fundamental level. Now, we don't have all the tools in the toolbox we'd like in controlling through zoning, but it certainly is part of our planning effort will be to push harder and harder on that. And then the other aspect of active transportation is, and we've seen this in the pandemic, where you have linked linear green spaces that link up to sort of community central areas where people can go and shop and do that. They're actually incredibly highly used, and allows a bit of a spillover effect in that too, and perhaps even farmers markets and those other sorts of things to use those spaces. So we want to look for those opportunities to gang up those wins and get that in the new community design. And I know Inga worked directly on some of these policies, and Emily did some work on this too, so I'll offer either of them the chance to add to what I said.
I would concur with what Mr. Willis had just outlined, and focusing on the urban design and the human scale for commercial and surrounding amenities to make it more attractive and to nudge people to walk. Just to add to that as well.
Okay, thank you for that. I have a few other points I wanted to make. I need to say too, I do remain very concerned about the decision to expand the urban boundary. I think my concerns mostly stem from increased travel time, transport costs, the cost to the city, pollution, and the destruction of countryside. I know that there's trade-offs that come with this, but that remains a concern for me in achieving the goals that we're talking about. I think there's some very good things in this official plan, but I'd be remiss if I didn't say that. One of the other pieces in here talks about the discussion around affordable housing, the health imperative of housing access and support for implementing inclusionary zoning. I'm wondering if Emily or Inga can talk more about the advice that was given from an OPH perspective on those elements for the plan.
Do you want me to jump in, Emily? I wasn't sure if you're clicking. Oh, there's...
You can go for it if you've got an answer offhand. Okay, so the affordable housing components are included in the official plan, as well as the inclusionary zoning provisions. I'm sure you're well aware, the inclusionary zoning is a tool that the zoning bylaw will implement once the official plan is approved. So that's a next step kind of process. The affordable housing components that the Planning Act does permit for, we have set up the policies in the official plan to have as many tool kits as possible under the Planning Act. So those policies are there. We are aware that with regards to health, housing is a primary need. And so we have set up a number of different, what we call PMTSA areas, protected major transit station areas, that will allow for inclusionary zoning to be introduced in those areas. And it's pretty advanced because there are many different hubs allocated for PMTSA areas so that we can get as many inclusionary zoning type units in those different areas.
That is great. Thank you for that. Very, very helpful. And I mean, I also say OPH has passed a couple of motions in the last few months, well, several months. One of them was on the official plan and 15-minute neighborhoods and how we evolve. And the other was around, increase. Does it reference the concept? Is there more information that it provides?
Yeah, so the council refers to the induced demand, which is the sort of sense that the traffic will always build up to fill the space you create for it, and if you create it, then it naturally follows. The official plan talks about the role of the transportation master plan for setting a new framework for transportation that will match the new official plan. And the transportation master plan is going to follow the official plan later. And the reason why it's delayed this time, and in the past they've been done in tandem, But because of the pandemic, the fact that we cannot do origin demand model testing right now to find out where people are coming and going in the middle of a pandemic. We can't do the technical work to support it. It delayed a little bit. So the councillor's got a very interesting point that needs to be addressed in the transportation master plan that goes forward, because council will have to make some tough decisions about whether or not you facilitate more traffic by building more infrastructure, or whether or not you make some decisions to constrain it in certain situations. And councils in the past have constrained through the land use planning, the transportation master plan, certain road corridors. Richmond Road and Councillor Kavanaugh's ward is a good example where council made the decision not to widen it, even though there was a decision that it could have widened to meet the traffic demand, and they addressed induced demand in that situation. So councils have done this before, but that will come with the transportation master plan.
Okay, thank you so much to everyone, and especially Ms. Davies, Ms. Rosendahl, Mr. Willis. Thank you for all your hard work on this. It's really great that this concept took hold with the OPH and our planning staff working hand in hand. So back to you, Chair.
Thank you, Member Pinnell.
Thanks to everyone for their work, but no questions.
Okay, thank you. And finally, Member Tilley.
Just one, I think it's a great idea. It's great to see us moving towards these 15-minute neighborhoods and everything that can create as far as building up a community. In the past 9 months, 8-9 months, though, we've seen, and I appreciate the effort it's going to make in eliminating the use of motorized vehicles, but obviously in the past 8 or 9 months, we've seen the pendulum shift as a society where we've become dependent on motorized vehicles, whether they're because of delivery services. So whether it's the gift shopping that we're doing online now, or the meal shopping that we're doing online now to have things delivered to our homes. I see this beautiful 15-minute community where people would be encouraged to go out to restaurants and support local businesses. Have you taken into consideration how we're going to shift that pendulum back and get people away from sitting at home and ordering through motorized vehicle delivery services coming from those huge distribution centers now from miles or kilometers away into your community versus the other model we were living under before this pandemic? Just a thought. I'm sure it's been in your planning process as you've looked at the shift there.
Well, there are actually 3 different answers to that question, and believe me, we're quite preoccupied by it. The first is the transportation master plan is going to have to address the on-demand consumer society that's been created, which was didn't exist the last time we did the transportation master plan. It has happened that fast, but this is really new for us and what it means. And we may ultimately have to deal with some design guidelines for buildings to address this as well in the raw land use policy. The second side of this is that really that with the 15-minute neighborhood, we hope that the people's preference will be, they'll feel more attached to their local community, that they're just basically like, I know some of the councillors who are at the table, for example, are very attached to walking to certain businesses in their area because they're very connected to their local communities because they're in walkable neighborhoods. And when you're not in a walkable neighborhood, you just don't feel that attachment. So therefore it doesn't make the same relationships. So the very, very social relationship created by the 15-minute community should combat that to a certain extent. And then finally, just put a plug in, City of Ottawa is pushing out a heavy campaign right now for people to encourage, for employers to encourage their employees to shop local over the winter season. So I'll ask the public health to consider that as well. This is an important part of our response to our current emergency. And I think the more we as a society and our city build a loyalty to our local businesses, that will combat that issue as well. So there has to be a planning aspect, but there also has to be a sort of a social value aspect to it that we have to create.
Yeah, and hopefully, again, this will be all developed well post-pandemic, and therefore there's always opportunity for that pendulum to shift the other way as they often do.
Thank you, Member Tilley. Just one really quick question, Mr. Willis. You've referenced several times that this is a new kind of partnership. You haven't seen this previously across the province or even possibly across the country. Are you talking about it? Are you sharing the experiment in planning circles with your counterparts in other cities?
Well, actually, I'm very pleased to announce that that in any day now, Plan Canada will be issued with a joint article that I authored the main article, but Inga worked with Alain Migueles to write a piece of it related to 15-minute neighborhoods, and we're talking about our partnership in that article. So we absolutely we're on it. It'll be out any day now for us to share the word. And you know, when time comes and we're back to having conferences and those sorts of things to share the effort, we will. I mean, other communities have talked about the planning interrelationships, but I have not found a public health planner embedded in writing the official plan anywhere else. So I hope we're the first, and I hope everybody follows our lead on it, because I think it's the right thing to do.
Well, thank you for sharing that. And I don't know if there's an online option for where you've had the article published, but if there is, Steve, if you could share that with the board secretary, that she could share with the members of the board, I think that would be greatly appreciated.
We will do that, Chair.
Thank you. Can we vote to receive the presentation?
Received.
Okay, thank you very much. And thank you all for your hard work on this. Much appreciated. And now is my opportunity to provide my verbal update. So good evening, bonsoir, Kwe. As indicated in the COVID-19 report listed on tonight's agenda, in mid-November, the Government of Ontario introduced an updated COVID-19 response framework for keeping Ontario safe and open. It provides a color-coded system, green, yellow, orange, red, and gray, with different levels of restrictions in each color classification and indicators and thresholds for regions to move from one level to the next. Ottawa is currently in the orange or restrict zone, and we've seen a recent decline in local COVID-19 rates of transmission. This is good news. However, since the provincial framework's introduction, we have seen some Ontario jurisdictions move into lockdown, whereas others were moved from orange to red, and several others went from green to yellow. This serves as a reminder that a rapid rise in COVID-19 infection rates is always possible. Therefore, we can't sit back and just wait. It's important that we continue to practice public health measures to keep decreasing the level of virus in our community, which will help us in turn avoid hospitalizations and deaths and the closure of businesses. I want to thank Ottawa residents for their continued efforts to slow the spread of infection in our community. The fact that we're seeing a slow decline in COVID-19 transmission locally is due to everyone's collective efforts. And again, we can't say thank you enough for everyone working together on this. I also want to thank residents for continuing to do everything they can to support local businesses. And I thank the businesses for their ongoing efforts to create a safer shopping experience and a safer work for their employees. In my November Ottawa Community Action Plan Virtual Summit, which was scheduled for November the 20th. I encourage members to participate. Tonight, I would like to provide an update on that event. First of all, flat out an amazing event, so full of energy and information. The virtual summit, jointly hosted by Ottawa Public Health, the Royal, the Community Addictions Peer Support Association, the Canadian Centre on Substance Abuse and Addiction, and the Canadian Public Health Association, brought together over 150 individuals representing a cross-section of national and community organizations, agencies and individuals from healthcare, municipal government, including law enforcement and first responders, and various other community organizations. Since the previous summit in February of 2019, many strides have been made to advance the Ottawa Community Action Plan. These achievements have included improving coordinated access and creating innovative ways of delivering services while also focusing on subgroups of the population that have been underserved. The successes in Ottawa are being shared on a national level through the partnership with the Canadian Centre on Substance Abuse and Addiction, so that other jurisdictions can learn and implement similar programs and processes. While there's been much success, mental health and substance abuse continue to be top concerns for Ottawa residents. Current challenges, as cited by the keynote speakers during the virtual summit, included a lack of resources, requiring a focus on partnerships for real change, the public not knowing how to access services, and a number of at-risk groups such Black and Indigenous communities continuing to be underserved. Challenges also remain in terms of ensuring that people with lived experience are at the forefront of the conversation and are engaged as an integral part of the solution. Understanding these challenges, there was a consensus that collaboration was an important focus and something that provided hope to participants. A full report is being prepared and will be shared with the participants, the Board of Health, and the community when it's ready early in the new year. In the interim, I would like to thank all those who participated in the virtual summit and those who continue to work to advance the Ottawa Community Action Plan. Lastly, I want to speak to the holiday season, which is just around the corner. I know a lot of people have questions about how to safely celebrate Hanukkah, Christmas, or Kwanzaa this year, given the ongoing risk of COVID-19 transmission. Last week, the province released guidance for safer holiday celebrations. Like us, they are recommending that people only celebrate in person with the people they live with, and for those who live alone, exclusively celebrating with one additional household. We know that some activities are safer, whereas others carry more risk. Ottawa Public Health has begun messaging tips and ideas on safer ways to celebrate this holiday season and will continue to do so in the weeks ahead. I encourage board members to share those messages broadly to help residents so that they can make informed decisions for themselves and their families. That concludes my verbal update, and I'd be happy to take any questions. If there are no questions, can we receive the verbal report?
Received.
Thank you. I'm now going to call on Dr. Etches to present her verbal report. Over to you, Dr. Etches.
So good evening, Kwe, Enge, Tanishi, bonsoir. In tonight's verbal report, I'll provide updates on the fall's influenza immunization campaign and preparations for an eventual COVID-19 vaccine and the reopening of some of our dental clinics, our focus on mental health supports, and a recent report on COVID-19 and racial identity in Ottawa. So starting with the season's influenza immunization campaign, as indicated in my November 2nd verbal report, Ottawa Public Health began operating its flu clinics on October 29th at 6 fixed locations across the city. We have since merged the 2 Orleans clinics into one location in order to free up resources to start mobile clinics. And the decision to operate in fixed locations was to ensure our ability to incorporate the COVID-related safety measures such as appointments and client flow, and to avoid crowding, to have physical distancing in terms of the clinic layout, enhanced environmental cleaning, staff and client screening, and more. And initially, we experienced very high demand, with appointments filling up within hours of opening up for bookings. We have seen a decrease in demand in the past week or so. To date, Ottawa Public Health has vaccinated over 48,000 clients through our different clinics, whereas last year, during the entire flu season, November to February, we had immunized 11,300. So the OPH mobile clinics will continue to operate for the next 2 to 3 weeks across the city. The mobile clinics consist of an RV and buses that are deployed in specific neighborhoods and communities to address barriers in accessing the vaccine. And lastly, the province has informed us that we will be receiving FluMist, the nasal spray influenza vaccine, this week. And this vaccine will be available in pharmacies, in physicians' offices, and at all Ottawa Public Health clinics starting December 4th for people ages 2 to 59. And communications have been shared with our primary care providers, our vaccinating partners, and public messaging will be added to our website to inform the public. So pharmacies and doctors' offices continue to be an option for residents to access their flu shot. The COVID-19 vaccine campaign, it just sounds great just saying that, doesn't it? I'm so pleased. We can see it coming. It will build on the experience of public health units having a lead role in influenza, or well, all immunization strategies for the population. La campagne de vaccination contre la COVID-19 profitera de l'expérience des unités de santé publique dans la mise en œuvre des stratégies d'immunisation de la population. So a lot remains unknown about the eventual availability and distribution of a COVID-19 vaccine in Canada, including the Health Canada approvals, official recommendations on sequencing of the vaccination within those priority groups identified by the National Advisory Committee on Immunization, and which conditions may be needed to keep the approved vaccines active as they're shipped across Canada. However, once a vaccine is available for use in Canada, the priority is to ensure that people are vaccinated without delay. And to that end, on November 16th, the city announced the establishment of a COVID-19 vaccine distribution task force to develop a comprehensive plan for vaccine distribution in Ottawa. This task force is being led by the City Emergency and Protective Services Department. It will ensure that all city resources are optimized and available to support the immunization of our community against COVID-19 as the vaccines become available in the coming months. The city's task force is leveraging expertise from across the organization, and it includes consideration of internal and external partners, such as those hospitals that are providing leadership across the region and those serving populations at higher risk, linked to the ongoing work of the city's Human Needs Task Force. So the task force will include public health leadership, or it does include public health leadership, and the collaboration is really going to, again, avoid duplication of efforts between different contributing organizations in the local context. So I'm feeling very positive that everyone is on board in the spirit of collaboration and getting this task done as quickly as possible. Last week, the province announced a similar vaccine distribution task force for Ontario, which will include cross-government and external representation with diverse expertise in operations and logistics, federal-provincial relations, health and clinical domains, public health and immunization, information technology, and data. And the provincial task force is being led by retired General Hillier. So, as indicated in the COVID-19 update report on today's agenda, Ottawa Public Health is learning from its experience of operating influenza vaccine clinics in the context of a pandemic, and we're preparing for our role in ensuring that a critical mass of Ottawa's population is able to access the COVID vaccine in a safe and timely manner. Certainly one of the learnings has been the importance of the booking online and the ability to work in partnership with other immunizers, public health and community physicians side by side. Also in recent COVID updates, we've been highlighting some of the unintended consequences of the pandemic response, particularly the impact on some less advantaged populations. So Ottawa Public Health continues to reinstate and adjust some of our most crucial public health services to try to support populations with lower income. So tonight, I'm pleased to share that as of November 23rd, Ottawa Public Health has reopened the St. Laurent Dental Clinic for emergency dental services. And in addition, the Wabineau Clinic will reopen part-time starting this week, Thursday, also for emergency dental services. During these challenging times, Ottawa Public Health has needed the support of our partners, and we greatly appreciate the Ottawa Dental Society's willingness to work with us to identify dentists who can treat the most vulnerable residents while Ottawa Public Health services have been reduced due to the pandemic response. Their continued work in providing emergency dental care throughout the pandemic has undoubtedly kept many out of hospital emergency departments. Le travail continue pour fournir des soins dentaires d'urgence tout au long de la pandémie a sans doute permis à de nombreuses personnes à éviter les services d'urgence des hôpitaux. Another repercussion of the pandemic relates to the impact on the mental health of our community, which is of particular concern. In June, we presented some initial results from a population-level survey on the status of mental health in our community. And the June survey found Ottawa residents were reporting worsened mental health and emotional well-being, loneliness, and weaker community connectedness. Further, many residents were reporting that they had wanted to talk to someone about their emotional state or mental health, but did not know where to turn. So we repeated this population-level survey in October. This is after schools have been opened and just as the province announced the modified stage 2 restrictions. So for context, we did also compare this data with 2017 Community Health Survey data, the Canadian Community Health Survey. So a preliminary snapshot of the October data reveals that overall, Ottawa residents continue to report worsened mental health and emotional well-being, loneliness, and weaker community connectedness. Un aperçu préliminaire des données d'octobre révèle que dans l'ensemble, les résidents d'Ottawa continuent de faire état d'une détérioration de leur santé mentale et de leur bien-être émotionnel, de leur solitude et d'un affaiblissement des liens avec la communauté. I have some numbers here, which hopefully you can stay with me through. In October, there were 40% of Ottawa residents reported their overall mental health and emotional being was fair or poor in the last 2 weeks. And this is similar to 38% in the June survey, but much higher than the 9% in 2017. 51% of Ottawa residents indicated their sense of belonging to the local community was somewhat weak or very weak in the past 2 weeks. This is similar to the 52% in June, and comparing again to 2017, that was 30%. Approximately 60% of residents continue to express feeling some sense of loneliness over the past 14 days, similar to 58% in June. 1/4 of Ottawa residents continue to report that there have been times when they wanted to talk to someone about something on their mind, including their emotional state or mental health, but they did not know where to turn, compared to 29% in June. That's not statistically different, and it does suggest there's room for improving communications about available resources. Now, with schools and many more childcare centers open, Ottawa parents are showing some indication of coping better, with 86% reporting that they were handling day-to-day demands of raising children during the COVID pandemic somewhat or very well, compared to 70% in June. We have also seen some small improvements among the surveyed parents over concern for children missing out on social interactions and school supports when we compare October to June. However, some parents report that they're coping less well. And generally, these include parents with lower household income and parents with a disability. So we're working to further analyze the complete results of the October survey to see further which populations are most affected. And we'll continue to share these results and use them to inform and drive our work, as well as to inform our community partners who provide vital services and supports to residents. As noted in the COVID-19 update report on today's agenda, we're working with partners to address gaps and barriers to providing some in-person service, as not all clients may be best served virtually, although the virtual services have greatly expanded. We're also working on new messaging to provide residents with information and resources to help get through the coming winter months. We know that it's a time with shorter days where that can have an impact on our mental health. The pandemic is highlighting how inequities in people's experiences of racism, housing, education, and employment are creating different barriers to health that pre-existed COVID-19, and the pandemic's underlining the need for immediate health and social services supports and long-term solutions to those with the least advantage. So last week, Ottawa Public Health, in collaboration with community partners, published a report on COVID-19 and racial identity in Ottawa. Some of the key findings included that racialized populations, particularly those who identified as Black, are overrepresented among people diagnosed with COVID-19 in Ottawa. Among most groups, females are more likely to be diagnosed with COVID-19 compared to males. And in general, close contact is the greatest source of COVID-19 infection, which is more pronounced among people who are racialized. Like people working in the healthcare sector are most impacted by COVID-19, particularly among people who are racialized. The racialized communities may have difficulty limiting exposure to COVID-19 due to factors such as higher density housing that makes physical distancing difficult, or employment in essential work that is often more precarious. Ottawa Public Health, therefore, continues to work with affected communities to better understand people's lived experience, to inform the solutions to improve access to health and social services and prevent further transmission. Ottawa Public Health is supporting the work to modify and orient interventions and services to reduce the inequities with an understanding of the unique needs of populations that experience marginalization. This work is work that Ottawa Public Health undertaking through various partnerships and initiatives. So essential partnership with the Ottawa Local Immigration Partnership. Others help us understand the situation giving rise to the numbers. And then working with the Ottawa Health Team for neighborhood outreach activities. Really adapted to each neighborhood where we see higher rates. We're supporting people through the Neighborhood Ambassador Program with the Boys and Girls Club of Ottawa and the Integrated Neighborhood Service Team to facilitate connections with youth in the identified neighborhoods. Ottawa Public Health's overarching goal is to enable everyone to do their best to limit COVID-19 transmission, recognizing we are all connected and some communities require higher levels of support given the social and environmental risks that exist. So consistency in our efforts to protect one another and care for one another will carry us through the winter. La régularité de nos efforts pour nous protéger les uns les autres et prendre soin les uns des autres nous permettra de passer l'hiver. So that will conclude my verbal report, and I'd be happy to take any questions. Il me fera plaisir de répondre à vos questions.
Thank you, Dr. Etches, and we'll go to our list. Member Banham, any questions? We still can't really hear you.
What about now? Can you hear me?
Yes, absolutely. Yes. Crystal clear.
Okay. All right. No AirPods. Thank you so much for your verbal report and everything that you and the rest of the staff are doing. Certainly, I feel like the Ottawa community has never felt so close. What I'm wondering, and we kind of talked about it at the last meeting, as we start to bring on services or bring back services back to where we were before COVID hit, I'm wondering if the Healthy Growth Program and the home visiting, if that has resumed. I'm thinking about when we look at, long-term effects of the breastfeeding support that home visitors provide, or being there during times where maybe the baby blues are setting in, etc. Those are all parts that the home visitors, the nurses that work for Ottawa Public Health, that they're involved in. They're also doing screening, from my understanding, to ensure everybody feels safe at home. And so I'm wondering, have those home visits resumed? And if not, how are people specifically within that demographic being serviced?
Thank you. I'll start off, and then I'd like to pass the opportunity to comment further to Esther Mogadam. So we know that this is an important service to set people on the right path for the rest of their lives, potentially. And so we have currently at this point 50% of the capacity as usual in the Healthy Growth and Development Program. And that is constantly being reviewed to see how we can augment it. I'll just ask Esther if she wants to add.
That's correct, Dr. Etches. We're also trying to reach families in a very different way through virtual visits, and also where we can, bringing residents to see us and through our community partners with respect to breastfeeding support. That's something we've worked very hard to resume, and through our partners at Mothercraft and actually the Montfar, we've been able to resume some of those one-to-one breastfeeding support services.
great. That's all from me. Thank you.
Thank you very much. Member Kluchek.
Thank you, Chair. Thank you, Dr. Etches, for the update. I have no questions.
Vice Chair, please.
Thank you for the update, Dr. Etches. My question actually is similar to Member Banham, but as the services are resuming, and so I'm thinking specifically around the dental, is the experience that the clients served are more acute, or that they've slipped back in some ways as their services come back, and will that require additional effort from OPH and additional resources to meet those needs?
I can respond to that, Dr. Etches, and then maybe I'll invite you to add as well. So through our 4 clinics, every day we pre-COVID, we would see 140 clients that were in need of, generally speaking, emergency services, people with abscesses and needing an assessment. We're fortunate to have a dental community that has really tried every effort to work with us, and will continue to see clients as they can. But as we reopen, we at this stage still have the majority of our staff still redeployed to COVID operations. We really are only able to see a very limited number. Our goal is to try to at least stand up every clinic in some way, just for primarily access reasons for some very vulnerable populations. We're just assessing now, actually meeting, I believe, tomorrow with the Dental Society, just to get a sense as to what the backlog is, and to come together as a community to try to address it and see how we can do that. So it's still very early. We've just reopened, and there is going to for sure be a need that we won't be able to address fully, and it will something to monitor though and continue to work towards.
Thanks. It sounds like it's a great partnership. I guess I would just the post-COVID recovery is something that we just can't forget about. We keep thinking about the vaccine, but it will take us a while to dig ourselves out of this hole.
Yes, and I just thank you for raising the question, because we hear about it more in the healthcare system, the service that people have missed, the surgeries, the health interventions, and the same is true in the public health world, that there have been services that people have missed, and investments to catch up would be very welcome, so that this is something that we'll be speaking about with the government as we prepare, go further into the recovery.
Perfect. Thank you.
Thank you. Member El-Shantiri.
Thank you, Mr. Chair. And Dr. Etches, I heard you before, and I heard some of my colleagues when we talk about the increase of cases in the racialized community, and we talk about the number is so high in the self-declared Black community. And when we talk about self-declared Black community, is that including the Somali community, the Egyptian, like anyone from Africa continent, or like the African Canadian, or like when we say the Blacks, who do we mean by Black? I'm sorry, but I need to understand this, because I had a problem identifying this in the past, and still haven't not really understand when we talk about the percentage of it. I understand there's a high percentage in that community, but who are this community?
So typically, if people would self-identify as Black, if they are, from an African community or Caribbean community, and that is their background. Yeah, and so definitely these people who are born in Canada, as well as newcomers to Canada, or immigrants who have been here longer. This relationship with immigration being prominent in the data as well. We do see that people who have immigrated are at higher risk of the COVID infection. And so it follows, some of the other demographics that are related to immigrating, where the employment and income options may be different from the general population, potentially creating a greater risk of exposure. So all of these variables. So we don't actually have the ability to break the data down further in terms of specific, but it would include Somalian. We can look at different languages that are used, and part of exploring this information with the community is for the community to make sense of it as well. So there's a lot more behind the numbers, other dynamics and things that are important to guide the interventions. And so the Ottawa Local Immigration Partnership has been helping with making those connections into different communities, so that we do adapt to the more specific communities, neighborhood by neighborhood.
Thank you for that, because often we hear, well, there is a small percentage of Ottawa population are identified as Black, but then when we talk about COVID and we see that number, some say, oh, it's a high percentage. I understand the high percentage, but I think the Canadian immigration, they consider anyone from certain age and from Asia also is Black, like African, Egyptian. So I'm just trying to understand, like, other than the percentage, is the number, like who is been identified? And I know it's a self-declared, I understand this, but still who is, can I say I'm Black?
So I don't know all of your background, so I don't want to judge, but typically, people would identify, and you can't, people who are Black live all over the world, so they could be coming from Asia, they could be coming from England. This isn't specifically related to just geography, but if you identify as Black, then yes, that would be counted.
Thank you. Thank you. Thank you.
Thank you. Member Gower, please.
Thank you, Chair, and thank you, Dr. Etches, for the update. I wanted to ask about the vaccines. I've already seen anecdotally and heard anecdotally, there are some public concerns about safety. And I was wondering if as part of the task force or as part of what Ottawa Public Health is doing with regular opinion surveys, are you doing any research into what public perceptions are, and any thoughts around proactive messaging or communications plan to communicate with residents in Ottawa about vaccines and safety?
When it comes to regular, vaccines and participation in childhood immunizations, for instance, it really is the vast majority of the public that participates and immunizes their children. So, 1 to less than 2% of the population, opt out of school immunization program, for instance. We are aware that it will be important to communicate clearly to the public what the assessment process is for new vaccines, and what the safety information is. We anticipate that this will be communications that are needed across the country, across the province, and so we don't want to duplicate work that is likely to be created federally, if not also provincially. But we'll be speaking with our provincial partners about the need to have coordinated and clear communications on this issue, as well as other aspects of the immunization campaign. And so I expect that will be part of what I can inform you about. Right now, we're working to clarify those roles at the different levels of government.
Okay, thanks very much. Thank you, Chair.
Thank you. Member Kavanaugh, please.
Thank you very much, Chair. And I appreciate the emphasis made on racialized communities and vulnerable populations. That's very important. I'd like to know more about on how we assess access to resources and information. to make sure that people have access. Obviously, some people have more access than others, i.e. internet service, being able to get into a car and go to a clinic. How are those done, and how is that going?
So I can speak generally about the process that's being used in partnership, but typically if we are seeing a cluster of people testing positive for COVID-19 over time, then we're looking to identify any networks within those communities, community associations or cultural groups, and then to work with the existing service providers such as a community health center or resource center to inquire about what the communications needs might be, if there are gaps because certain languages aren't being used. But we are also then exploring the needs further by talking directly with residents. So some of the strategies that have been used include working with the Ottawa health team to go door to door and actually ask people. And we do find a range of needs, which is informing the ongoing response. And so the kinds of things that can be found are that people don't know where to go for testing for COVID, or they don't know that there are supports available if somebody has to self-isolate to be able to access food, for example, or even healthcare. So there are different gaps being revealed and discussed, and the Human Needs Task Force is also very important in meeting those needs when they're identified, if they're more of a social service nature. But the health needs for primary care exist. We know that many newcomers to Canada do not have a primary care provider. And so the community health centers are playing a key role in linking people to better supports.
Thank you. And in terms of the vaccination, how are we going about to make sure that we get that information out and prioritize vulnerable populations?
Well, I think what's being established right now as we identify communities with higher risk, these relationships with community members will continue to be very important channels for communicating about the vaccine when that time comes. So we know that the work to address these inequities is going to have to be long-term. It's not just related to the pandemic. And so this is what I say when I'm very pleased we're seeing a reorientation of our health system to better support communities with greater needs. And I expect that will continue through the vaccination process and beyond.
I like to think that we're leading by example. If we have to make this pandemic some kind of victory, that we're working towards that goal. That's what it sounds like to me. So thank you, which I see as your priority. Thank you so much.
Thank you. Member Lakin, please.
Thanks, Chair. Thanks, Dr. Etches, for your report. Yeah, you're right. It's nice to have you being able to comment on a vaccine response in your remarks. That's kind of encouraging. And it's the encouragement and hope I'm looking for in the question. Your comments about the mental health consequences of COVID in our communities, it's concerning for all of us. And you've said what anybody who works in the area knows, which is it's a dramatic stress for the entire city. Under normal circumstances, the OPH's mental health team would have a robust response for
our mental health team, if you were to go back pre-COVID, doesn't really exist right now as it was. We still have the lead manager and some few people working on mental health with a particular, emphasis right now on Black mental health and implementing actions that came out of the report that we worked on. However, we have new channels that have been established through the school nurses, for example. So we hired, I believe, about 45 nurses and more supervisors to support the school health response. And we're finding that the needs to support mental health of children and youth and families as well by extension is really of interest. And so we're growing that channel to support communities to be able to know where to access and to get supports. The work on the community action plan around mental health and substance use continues as well, like the summit that the chair referred to and participated in. And there is progress happening there around coordinated access to mental health and addiction services and virtual services. And so certainly Ottawa Public Health is not, we're not we're just a piece, we usually try to focus on prevention and mental health promotion, but the clinical mental health services, I feel they're making progress in growing options and connections. The work to stand up more services, continues around the mental health team as well, the size of the team. We want to make sure that we continue to have more people able to focus on this subject. We have also asked the province to focus on mental health campaign. So we wouldn't need to use as many resources locally if we could build off of a provincial campaign that promotes access to existing mental health services and fosters an environment where people can identify warning signs and reach out or support a family member who might need more support. We're interested in suicide prevention. That is one of the areas of work that's continued. So suicide prevention by training community leaders, that's grown. We've continued to expand the number of community leaders who are prepared to work on suicide prevention. And our work on the harm reduction front, we often see substance use and mental health linked, continues with access to safer supply. So there's some new services being stood up even in this time. But I think at the root, if we can grow the team, that is what we're aiming to do, because we see this need continuing and growing as the data shows us. I don't know if anyone, Esther, if you want to add anything. I'm not sure if Esther's still with us in this format, but does that answer your question, Member Lake?
Yeah, it's helpful. Thanks. I just wanted to, if I could, just a quick follow-up. You mentioned channels. Does OPH have channels with other city departments to recommend or even promote, support some COVID-friendly mental health promotion strategies? I'm thinking of something completely silly like ensuring Parks and Rec keeps the lights on longer at a rink, or community housing has safe spaces, COVID-friendly safe spaces where someone can visit another individual. Do we have channels that can support COVID-friendly mental health promotion during this period of time?
Yes, we do. And that is part of what we're doing right now through promoting physical activity in the winter. And the city has shifted their programming to be more outdoors. So they are making more options available through their Parks and Recreation program by moving things outdoors. And the communications department of the city is the partner in spreading the word about some of the things that will help us with our mental health by staying active. That's really an important element through the winter and getting outdoors. The city is also helping us with the integrated neighborhood services team. That's the one with the youth ambassadors and the work on the ground in communities with higher needs to promote more activity in neighborhoods. I also wanted to just go back to, we touched on Councillor Menard's comments about the community safety and well-being plan. So again, Ottawa Public Health is not the only body that can advance mental health and substance use solutions in our community. The Community Safety Wellbeing Plan has many, many partners who have identified mental health and substance use as a priority, and that will bring more integration across city, programming, as well as the mental health service sector. And that, you know, it's new under the framework of community safety wellbeing plan. There will be new leadership and, you know, collaboration, but there are many aspects that are currently underway that will be fostered by that work and that network. So yes, I think I would say the city is on board as a partner and will be contributing to mental health in our community.
Thanks so much. Very thoughtful response. Thanks, Dr. Etches.
Thank you. Member Menard, please.
Thank you, Chair, and thank you, Dr. Etches. I have a few questions. Previously, we had heard that our hospitals were struggling. I understand there's still some struggle. What is the status and situation right now in terms of ICU, elective surgeries, and other operations? If you are able to, I'm not sure if you're able to provide an answer on that, but
I can speak to it at a high level, and we have a dashboard for COVID monitoring indicators that does actually give the status of the hospital capacity, the ICU capacity, and the ventilators being used as a percentage. My screen says it's loading data right now, but I can tell you when I checked it earlier today, I believe our hospital capacity has come down from where it was over 100%. It's now about 96%. And I think there are some solutions being found for one of the pressures, which was the alternate level of care that some patients required, needing long-term care home spaces, and long-term care homes were not admitting people. And so the government of Ontario supported hospitals to expand long-term care capacity in the region, opening up new spots. And so that seems to have made a bit of a difference. The backlog in terms of surgery, though, it's a real pressure. It's continuing. I think that's for all ages, children and adults. And but our ICU capacity is sufficient, and we have again not very. I don't have the number with me, but the ICU bed, the number is very small. I think we only have about 2 or 3 people in ICU right now.
Okay, thank you for that. In Ottawa, we've experienced a large second wave, much greater than the first wave that went through. What is there internal modeling that will tell us when a third wave may come? I don't know the timing of the vaccine and when that's going to get rolled out, but do you see another potential spike coming before the vaccine is rolled out? Is that something that you've modeled or looked at?
I'd like to encourage everyone in Ottawa to think about this as an ever-present possibility. Next week, the week after that, all through the winter, it's possible for us to see a rise in COVID in our community if we relax the precautions that we're taking now, if we come into contact with more people, if we don't wear our masks as often, if we're not keeping our hands clean. We really have to be consistent and have a stability in the approaches we're taking through the winter. And we know this because we've seen it. COVID comes back every time we open up the opportunities for more close contact with each other. And so I want to thank people, of course, in Ottawa too, for maintaining this. This is hard. It's about establishing new routines so that this is, what's our new routine? Now people know they have a mask with them. What are the other ways we can make sure we support each other through this? Your new routine to connect by text, connect by video. There's other, all these pieces are just going to have to be the normal way we go through the winter.
Okay, thank you for that. And my last question is around the flu vaccination. Just in terms of where we're at in terms of our targets. I know our own OPH clinics are, we've more than tripled what we've done in previous years. What is it in terms of overall in Ottawa, in terms of the numbers of folks vaccinated? And are we extending the flu clinics that are available now there was a certain date, for example, at Lansdowne, and they had told me that date. Is that going to be fixed for that date, and we're going to rely on individual providers and pharmacies, or are we extending those?
Thank you. I'll invite Marie-Claude if she wants to speak to any specific numbers. The accounting for what proportion of our population is immunized will not be complete until later, probably even next year, because we don't have the numbers for pharmacies, how many people pharmacists in Ottawa have vaccinated. We do have our numbers, and we know how much vaccine we have distributed out to the community. So my understanding is that's at least 200,000 doses of influenza vaccine that have been distributed. And in terms of the timing of our clinic, we will continue them as long as people are interested, are still booking appointments up until, I believe, the week before the holidays.
Okay, thank you very much, Dr. Etches. Thanks, Chair.
Thank you. Member Pinnell, please.
Merci pour la présentation, Dr. Etches. I've got no added questions. Thank you.
Thank you. And last but not least, Member Tilley.
I'm just wondering, Dr. Etches, so further to the, it sounds like great work on the mental health supports, and thank you, Dr. Lakin, for your in-depth questions about that and the work being done. And then you mentioned about the harm reduction strategy, but further but further to that, along the area of substance use, I was thinking more of the softer aspects. We saw in the spring record level alcohol sales and record pot shop sales. And I just wondered then if the same way people were storing up all their Costco toilet paper, if maybe they were just storing up their booze and their pot for future use. But I haven't been able to find any records or details in my searches lately, but do you have any knowledge of alcohol consumption or marijuana consumption through the pandemic? Is there any indication that, of course, my question being that down the road, along with mental health, we could be dealing with further addiction issues along that line beyond the those who would be in the harm reduction field?
Yes, we have some data from earlier in the pandemic, and I believe we'll be looking at it again, that indicated some people are drinking more alcohol and some people are drinking less. And it is a concern. We always think about alcohol when we think about our substance use programming, because it is the most consumed substance and causes the most harm of substances that are used. And there were some concerning patterns before the pandemic in terms of women using alcohol and ending up in emergency rooms, those rates growing and approaching the rates of young men. So we continue to have that on the radar, and we're also highlighting this to the province where the opportunity arises to.
Okay, so again, maybe more work for Ottawa Public Health down the road, which is what you need right now, is will be the education piece on there's better ways to relax than consuming alcohol. But that was just my concern as well too. People staying at home bored, they're either playing cards, but you hate to think that they're having 4 or 5 glasses of wine instead of 2 or 3 a night.
We do have low risk drinking guidelines, and we would want to encourage better ways of dealing with stress than consuming alcohol. We also know the policy decisions are very important. So access to alcohol, unfortunately, the more alcohol is available, the more it can cause problematic use, and we are seeing some policy changes that counter health promoting policy. So we're as I say, we need to continue to address this.
Okay, thank you.
Thank you. Can we vote to receive Dr. Etch's report then? Received?
Received.
Thank you. The next item is our draft operating budget for 2021. I'm going to ask, though, Councillor Santé if he could move the motion to extend time, because it looks like we will go beyond 7 o'clock. We have a presentation, and then we also have one delegate and another report after this. So if you could do that, please, Member Santé.
Thank you. Thank you, Mr. Chair. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Okay, can we carry that? Reluctantly, but can we carry it?
Yeah.
Okay, thank you. Next item is, as I said, is our 2021 draft operating budget for the Ottawa Board of Health. As you know, we introduced this at a previous meeting, but we have Lou Flaboria here tonight again, and Lou is going to present a short PowerPoint presentation to remind us all of what we discussed previously and where the budget stands. And then, as I say, we do have one public delegation, so we'll go there after that, and then we'll take any questions or comments from councillors, not councillors, from board members. Okay, over to you, Lou. Thank you very much. I see the presentation, but I'm not hearing Lou yet.
There we go.
There we go. Thanks, Lou.
Well, thanks again, and good evening to all. You'll recall that when we tabled the budget with you on November the 2nd, we communicated several avenues for residents and stakeholders to submit questions or comments on the draft budget. This included a dedicated email address, social media, and telephone number. I can report that as of this afternoon, no communications have been received through any of these avenues. Tonight, as you consider the 2021 draft operating budget, we'll provide a brief overview since our last meeting. There have been no changes to the 2021 budget assumptions, which incorporate an inflationary growth base increase of 1.16 million from the City of Ottawa, assumes a 0% provincial base increase from the Ministry of Health, assumes all one-time requirements will be required for the entire year and provincially funded at 100%, and lastly, does not include provisions for activities related to providing a COVID-19 vaccine to the public. Next, the provincial government has announced its budget on November the 5th, and there was no additional funding for health units beyond what is highlighted in our budget report. And lastly, OPH has submitted its Q3 activity status report to the ministry and updated the funding request for extraordinary COVID costs from $12 million to $13 million, mainly due to reinstating core services outlined in the budget. Next slide. The next two slides, which were presented during the tabling of the draft budget, provide a high-level summary of the 2021 budget changes. And then, again, they include the base pressures for collective agreements and inflationary facility costs, which again total 1.16 million, and the one-time pressures for COVID support outlined in the budget report, and they total 22.5 million. The next slide provides the funding sources, which include, again, the city being there for the base pressures, and all one-time pressures being assumed that the Ministry of Health will pick those up. Next slide. Once the board approves the budget tonight, it will rise to council on December the 9th for final city approval, and then be submitted to the Ministry of Health for consideration. And that concludes the presentation, and ready for questions.
Well, thank you for that, Lou. We actually have a delegation before we'll go to questions. So our delegation is one of the councillors, Councillor Fleury. Are you on the line?
I am. Hi, Mr. Chair. Can you hear me?
We can hear you, and you know the rules. You have 5 minutes. And
yeah, thank you so
go.
much. Thank you so much. I was listening into the session and actually sort of tied into some of my question for this evening. Dr. Etches and team, just wondering, obviously COVID is front and center of all of our minds, and I certainly appreciate that. Yet there are some equity elements of our work, specifically on the dental clinics and some of the parenting in Ottawa effort, specifically for prenatal classes. I want to understand how you plan to try as much as possible to keep some of those services into 2021. So I know they're reflected in the budget, although we've had to put a pause due to COVID response and reallocation of staff. Just wondering if you could speak to both of those elements, the prenatal.
Councillor, normally you're a public delegation, so you'd be making presentation and not asking questions. I look to the board if they're prepared to be flexible on this for your 5 minutes, and maybe if people could sort of raise their hands as to whether they're okay with that. For the most part, people are raising their hands. Okay, so we will allow questions for the 5 minutes. Councillor Flory.
Thank you, Mr. Chair. Yeah, it's my only sets of questions which relate to, again, parenting in Ottawa, specifically the prenatal classes and the breastfeeding support that we offer. And then additionally, I know Dr. Etches was speaking earlier about the dental reopening of some of our services at the Wabano specifically. Wondering though, we do have other service points. What's planned for that in the 2021 budget?
Thank you for the questions. Let me just speak overall to how we're approaching this budget in terms of being able to provide essential public health services. And the two you've noted are among the top priorities for our essential public health services. We are reinstating as much programming as we can, as we also do what we need to do to respond to the pandemic. So we know that we have to do both. And the budget as presented is really for a scenario where the level of COVID remains about as it is. And if we continue to have decreasing levels in our community and things are under control, we'll be able to do more of our essential public health services. And if things get worse, we'll have to reassess and potentially spend more on the COVID response. And in that case, we would be letting the board know and also reporting to the province about increased financial pressures. And so for the dental clinics, Esther Mogadam mentioned, we are trying to provide some service at each of our 4 sites in the future. Right now, well, as of this week, there'll be service at 2 of the 4 sites, and we're looking to stand up some service at all 4 sites in the next months to come into 2021. For the prenatal services, we have been changing our approach over the last year, and I'll ask again Esther Mogadam to speak more about this. But we have tended to focus on populations that might not access prenatal supports through other means. So there are many prenatal service providers who provide services privately for a fee, and we were focusing on populations with barriers to those services and providing things virtually where needed. Esther, would you like to add to that?
Sure, and yeah, I just have to say I think the question is so important. Reducing health inequities to reach all expectant and new families is a key priority for us, for sure, and a key priority to rebuild. So Dr. Etches, yeah, I think that your point about expanding the reach of prenatal services to those most in need, so whether that be our youth, our newcomers, those living with mental health and problematic substance use, are a priority. We're working, continuing to work very closely with our community health centers and in trying to work with those populations, and then for others, complementing some of the prenatal education offerings through virtual means. I think the other approach that shows promise is a peer-to-peer parenting approach through the Ottawa Community Youth Initiatives is something I know that collaborative is very interested to move forward with.
Thank you. I can appreciate the challenging situation. Just as a minor follow-up, is it a question of resources, or it's an issue of budget allocation going into 21 to go back to some of the more traditional approach that we were used to from public health?
What we have right now is a situation where the nurses who did that work are currently doing COVID work. Some of them, not all of them. Our healthy growth and development program's at about 50% right now. And so we're looking at a process. It's underway right now, the process to bring people back from the COVID work. And if the COVID demand stays high, then we're looking at potentially bringing on more people to do the COVID work if we need to continue more of the healthy growth and development work. So we know these are services that cannot be suspended indefinitely.
Okay, appreciate that. Thank you, Dr. Etches and Chair Eglai.
Thank you, Councillor. I don't believe there are any other delegations. So what we're going to do now is I'm going to turn over the introduction of, well, no, actually, I guess, no. Hang on, we're not doing that just yet. I don't have to do that just yet. So we will be voting on this coming up, but we now have the opportunity to ask questions. I'll just read out what we will be voting on. That at the meeting of November 30th, 2020, the Board of Health for the City of Ottawa Health Unit 3, approved the 2021 draft operating budget for the Ottawa Board of Health. 4, upon the Board of Health's approval of the 2021 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to the Ottawa City Council for consideration on December 9, 2020, as part of the City Council's approval of the City of Ottawa 2021 draft operating and cap budget. And 5, upon approval of the 2021 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the medical officer of health or delegate on behalf of the Board of Health to forward the 2021 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2021 operating budget for the Ottawa Board of Health. And we will be voting on the budget by way of a roadmap motion. But before we go there, and at that point, as a result of the declaration of interest that I made, I will be turning the meeting over to the Vice Chair. But before we get there, we have an opportunity to ask questions of Dr. Etches or Lou and his team on the budget. So I was going to reverse the order, but I know that Member Banham has to leave shortly. So we're going to go back to Member Banham as the first person so we can accommodate that need of hers to leave the meeting. Member Banham, do you have any questions on the budget?
I really appreciate that. And actually, Member Fleury asked my question. So that is wonderful. So no questions here. Am I able to state that I will vote in favor of the motion since I'm leaving?
You can say it. It won't be counted as a vote, but it's a public show of support. So it will go on the record, and that's appreciated.
Wonderful. Thank you, and apologies.
Denton, the contribution to the solution, but we are going to be opening our dental clinic for the homeless, where we've been working with Dr. Tom Harrell. So that's going to kick in sometime. We're thinking early February. It looks like a lot of the dentists are just lining up and anxious to come back and volunteer, but we had to give them time to get their practices in order because of the backlog. But so that'll be a small bit, and we're in Councillor Fleury's writing, so I'll circle back to him. I don't know if he's still on the call, but that's it for me.
Thank you, Member Tilley, for that information. Member Pinnell, please.
No question, Chair Eglai. Thanks.
Thank you. Member Menard.
Thank you, Chair. Thank you for the presentation of the budget. I do have some questions. Primary question is about what services we're not completing as we would be as a result of COVID-19. And so there's some information in the budget documents, and there's some lines around critical services being reinstated as surge capacity demand allows. But I'm wondering which services are not being reinstated, if you can go through some of those.
So we've used our continuity of operations plan, which classifies all of our services in terms of how long can they be suspended. So we have some services we say we cannot suspend for 24 hours or 48 hours. And then we have some where we say they could be suspended for weeks. And those tend to be ones where we're trying to address a longer term issue like chronic disease prevention. And so really most of our chronic disease prevention programming has been suspended, is still suspended, and is not likely to be stood up in the same way. And so I think this is one of the key things that we are working on as a senior leadership team at Ottawa Public Health, is to learn from this experience and think about how do we do things differently in the future, not just stand up the services we used to have, because we know the needs in our community are going to be different in 2021, 2022 and beyond. And we've learned different ways to approach problems. We have new partnerships and new tools. And so really we are looking at things differently. We're using a risk-based approach for the things that can't be suspended for weeks, where we aren't getting to as much as we'd like. And some of that relates to our communicable disease and environmental health work, where we are having to look at prioritizing, for instance, right now, tuberculosis follow-up. And we were doing some of the other follow-up, like with chlamydia, potentially less or more virtually, like letting people identify their own contacts and that kind of thing. So we have not been able to do the immunizations in schools. That is something we can't delay very much longer because there are windows of opportunity for immunization of students. And so this is something we're looking at standing up as we finish the flu season. We'll be looking to people who have helped us with that campaign to continue on with catching up a bit on the school immunizations. So again, this is a program by program assessment of what do we need to do now, next, and what do we need to do differently. We're taking a look at the priorities across all of the different areas, working together, because often it comes down to the human resources and the people available to do the work and trying to prioritize.
Okay, thank you for that. That's helpful. With regard to the budget around the Ontario Seniors Dental Care Program and the Healthy Babies, Healthy Children program, those budgets appear to be frozen for this upcoming year. Based on what we're expecting from the province. And I know our own management of those programs seems to have shifted. So can you just give a few more details? I know we've had a couple conversations, but just a basic level, what that means for us.
Yes, I'll see if I've understood the question. So there are some programs that the province has typically funded at 100%. And those programs have had 0% growth in the budget over time. And so as the salaries grow, it means that we cannot afford the same number of people to deliver the program. And so we have to adapt to lower the service levels, to prioritize, to serve higher risk people, or we have to do things differently. And again, focusing on how do we extend our capacity through partnership, how do we extend our capacity through virtual connections, through peer-to-peer work. There's always value in looking at doing things differently, and the COVID has been helping that. So does that answer your question?
It's helpful. Certainly, and yeah, my question wasn't as clear as it could be, so that is helpful. I guess I'm just trying to come back to some of you know, there's the provincial increase we're anticipating, and we're putting it in the budget, and then there's the City of Ottawa portion. And sorry, my son's just here.
No problem.
But so on the City of Ottawa, just one second. On the City of Ottawa piece, the report notes the budget increase is about $1 million from the city to address cost of living and benefit adjustments determined by collective agreements and inflationary facility costs. So we're covering some inflationary costs and overheads with the increase, but it also, the report also outlines the large needs, immense needs and pressures on OPH that go far beyond inflationary costs. And the need is obviously, understandably, much more right now. And so, you know, other orders of government certainly need to be contributing their share, but on the city side, my concern is the priority that needs to be placed here, the other things that are going unfunded or unserved. And so, you know, we're increasing the funding for police services to an extent that goes far beyond inflationary costs at a time where the police service is not facing anywhere near the increased budgetary pressure and is getting 13 times more than the city funding of OPH. And understand there's different budget line items, but I frankly find it immoral. And I cannot square how we're doing this right now with Ottawa Public Health in the middle of the pandemic, with services going unheeded. And so I just, I guess those are comments, Chair. It's not really a question in there. I just find
They're definitely comments, not a question.
Yeah, I'm struggling with how we're going about this budget.
It may be helpful for me to clarify that we are looking at a 31% increase in our budget, but that most of that is provincial one-time funding.
Yes.
So this is the largest budget we've ever passed. It is more work than we've ever done in the community. And I think what I'm hearing in your comments is the importance you're placing on some of the essential public health services, not only the COVID response. And so we've spoken about some of them tonight, the mental health work, substance use work, we've heard dental, early childhood development. And I can just assure you that our senior leadership team feels the same way, that these are services we need to grow as much as possible.
Thank you, Dr. Etches. And I mean, Chair Gliswell, I'll be supporting our budget here tonight and appreciate all the work that goes into it. I guess my comments are that it's the broader picture that I feel like we're missing sometimes. And this budget is supportable from me personally, and I appreciate everything you've done. But I wish we were doing, the city was allocating more in this time of need. So I appreciate everything. Thank you.
Thank you, Member Blake.
Thanks, Chair. No questions about the specific budget, but I do get a chance once a year to ask this question, and so I'm going to ask not about the budget, about the revenue line item, and for future discussions, I have a question. And Dr. Etches or Lou, are we aware whether any other public health units in Ontario have arm's length sources of revenues, either through foundation or other revenue collection or generating schemes that can be used that are conflict-free?
I'm not aware of any, but I'll let Lou add.
Yeah, I'm not aware of any either. I think many years ago, when we had our finance subcommittee, when the board just assembled, we looked at those avenues and they came out dry back then. So I'm not aware of any that other health units are they currently have.
Okay, thank you. I'll probably ask this again in 2 years when you've forgotten I asked it this year. Otherwise, no other questions. Thank you very much.
Thank you. Member Kavanaugh, please.
Thank you, Chair. And thank you for this budget. Obviously, we need every penny, and it's all going to go to good use. My question is about, you talked about chronic disease prevention, and that's something that is going to have to, that was put aside is what you mentioned. And I'm just wondering, are we going to ease that back in? Because I'll have a bit of a cleanup act after COVID from the fact that people have, has been pointed out by member Tilly and others that that we're going to have to work on. Is that something that we're looking at in terms of down the road to make sure that we're planning ahead for those things that are going to come out of the pandemic?
Yes, I would also like to introduce the concept that we don't have to wait, but we are interested in tackling chronic disease while we promote physical activity for mental health purposes during the pandemic. Right, so these aren't separate issues, but they are connected. We can prevent chronic disease now through the pandemic. Certainly, you know, we spoke about substance use and addressing that now, promoting physical activity now, social connections now. So I think it's just a matter that some of our programming around chronic disease prevention will be shifting and is shifting. And so the traditional teams that are doing that aren't in place, but we will continue to grow that work. So we know eating well is important at any time. You know, injury prevention, we're trying to build these things in even through the pandemic.
I appreciate that. And I wasn't implying that that was on hold or anything. I just realized that there'll be more. So no, I appreciate it. Obviously, the whole goal, and this is why I want to be part of this board, is it's about preventative. And I can understand the feelings of Member Menard on that more resources need to be put into preventative, and as much as we can. Thank you very much.
If I may, just on that concept of contributions from the city, I was remiss in not mentioning that the city has supported us not only with the cost of living pressures that we had this year, but also with in-kind support over the years. So much of our back office efficiency comes from the relationship with the city and IT and human resources, but also in-kind support through the pandemic response.
Yes. Thank you very much.
Yeah, thank you for clarifying that, Dr. Etches. That's an important point. Member Gower, please.
I have no further questions, Chair. Thank you.
Thank you. Member El Shantiri.
I have no question, Mr. Chair, other than say thank you to Dr. Etches and her team, and also the question I have, and I'm not sure if the additional extra expense we have, does the city claim it from the province, like related to COVID, like your extra staff and extra? I know in other departmental goes to other department, but in the public health, does come to the city or comes directly to public health? I'm not sure if it's not a budget related, but just COVID related.
Maybe I'll see if Lou wants to add anything, but because we're overspending right now and the province hasn't flowed the money to us yet for our over expenditure, they will. We're fully anticipating, you know, for example, the $13 million in 2020. The city is sort of backstopping us. They're helping with the cash flow, and the reconciliation will come when the province finalizes our year end and our contribution based on what we spent in 2020. And then looking forward to 2021, we'd expect the budget allocations and approvals will probably come earlier in the year. This year, there's certainly, it's going to be late.
Okay. Thank you very much. And thanks again to your team for doing the flu clinic in the rural area that was well received. And thank you for that.
Thank you, sir. Member, Vice Chair, please.
Thank you, Chair. Yeah, my kudos to the staff as well. It's a tricky year to do any budget assumptions, and so appreciate that you have to make some assumptions and go forward. So I think that's well done. Also, like the fact that you talked to Dr. Etches about doing things differently. I do think that is a COVID opportunity when you have a bit of a blank slate to really be rethinking and reimagining how we do things. I do have I had two questions. One was around cash flow, so thanks for answering that. My only other question was really with the redeployment that's happened. So if we keep talking about dental, but I know there's been others that for the redeployment that's happened with the programs that are 100% provincially funded, do we have assurances that there's no clawbacks coming from the province for services? I know they've extended that to most recently to healthcare, and I just want to make sure there was some assurances from the public health perspectives that we're not accountable for outcomes that we couldn't possibly deliver.
Yes, we do have in writing permission to have reallocated those 100% resources to help with the COVID response.
Perfect. Thank you. No further questions.
Oh, you're on mute, Chair.
Eventually we'll get that figured out. I said thank you very much, Vice Chair, and on to Member Cloutier, please.
Thank you, Chair. Thank you, Dr. Etches and Lou for your work. I asked most of my questions on November 2nd, and thank you again to the whole finance team for their work throughout the year in adapting to COVID. And as the Vice Chair said, there are certainly some assumptions in this budget, as there are in all budgets, but we are certainly in an environment that changes frequently and unexpectedly, and the OPH has been adaptable and flexible to the nth degree until now. Dr. Etches or Lou, what are the critical assumptions on which you have built the budget? You talked about them a little bit at the beginning, 0% increase in the provincial government and no cost to providing the vaccines. The Vice Chair talked about the clawback and what assurances we do have that there will not be any clawbacks. What are the critical assumptions on which you've built the budget? Which ones are you watching the most carefully? And how will OPH change its implementation? How will you pivot if those assumptions change? What might we see during the year if those assumptions are found to be unfulfilled, untrue, incorrect?
I'll just check if Lou would like to go first, or.
Yeah, I can. I'll take a stab, and I'm sure I'm thinking more ideas coming into my head. So the critical assumption, each and every year, we're looking to maintain current services. So that's our very first assumption every year, to make sure that any cost of living increases funded. And if they're not funded, as we had to do last year, we had to make cuts in order to balance the budget. So that's an annual assumption that we have to look at. And then the next one is discussing with the ministry, are they going to provide us any kind of base increases? So we've had those discussions with the ministry already. They haven't given us formal formal confirmation that they're not going to give us an increase, but they've given us verbal confirmation. So that's another assumption. We didn't want to assume an increase for base from the ministry and then be caught short down the line. So that was another big assumption. And then again, the biggest one in this whole budget is the fact that the ministry is going to fund our COVID costs into 2021. We've had discussions for 2020, and we're feeling confident that they're going to provide the funds required to balance our budget for 2020, but we carried those assumptions into 2021. Other health units have done the same, in other major health units, and so the plan is that we'll continue with this process going into 2021. One of the big things in our budget is, however, there is one-time funding that the ministry has provided us, confirmation for 2020 and 2021 of $3 million that's part of our former or base, and they've provided one-time funding for that. And so they didn't say anything past 2021. So it's something that will be definitely on our radar, that they switched some base funding to one-time funding. And so that's something that we'll have to keep our eye on going forward into 2022. So hopefully that answers, Vera, I don't know if you wanted to add.
Sure. Thank you, Lou. Yes, I think that's really helpful about the assumptions. And what I'll add is what I'm watching. So in terms of two kind of avenues, of course, everyone's watching the COVID level in our community, and certainly if we have to handle more outbreaks, if we have to do more case and contact management, if we have to adjust our communications and surveillance approaches, if we have to grow our team to meet the demand to contain COVID, and then those will be pressures to either draw back from some of our essential services, but also potentially spend more to add to our team, or find, we're continuing to use technological solutions as much as possible to save money. So that's one pressure that could adjust the budget upwards. It could adjust it downwards as well. And so we would not spend the $22 million that are there as one-time COVID funding if we don't need to. And we would reallocate people away from COVID back to essential public health services. The other work that, or thing that I'm watching is what's happening with the needs of our community related to essential public health services. Do we have other types of outbreaks that are happening? Do we see that we are not doing enough in partnership, that we need to do more ourselves around mental health or healthy growth and development, and continue to grow these services? So we're looking out for harms to the community, and try to get ahead and prevent some of these other negative outcomes. So that would guide how much we reallocate back to essential public health services or protect those services going forward.
Thank you for that. And so if there are those changes based on circumstances and assumptions, we would get an update at the board on a quarterly basis.
The formal financial reports are quarterly reports. However, I believe our board secretary has asked for your participation in monthly connections, whether it's a board meeting formally or in between those formal board meetings, a monthly teleconference to share information. And we could certainly highlight the context of our finances and programs and services at that time.
Thank you very much. Thank you. Thank you, Chair.
Thank you. Those are all the questions. I have a quick question for the board secretary. In light of the fact that both myself and Member Lakin have matters that we cannot vote on in the roadmap motion, and the vice chair will be taking over chairing the meeting shortly, but should the roadmap motion then go by called yeas and nays to reflect the fact that myself and Member Lakin will not be voting on some of them, or is it still acceptable to simply go by way of carried if that's the case? And if so, how is it reflected in the record then that neither myself nor Member Lakin will be voting on certain items?
Traditionally, Chair, when we're meeting in person, what would happen is when we get to the line item where you or Dr. Lakin have declared your conflict of interest, you would simply pull your chair away from the table. In this instance, given that we are meeting virtually, we can see you on the screen. So if you back away and make a signal that you're not voting on those line items, I believe that would be sufficient. But I would defer to our legal counsel if he has anything to add, and I will bring him into the meeting just in case. If you'll give me one moment.
Okay.
Omar is now in the meeting. So Omar, if you have anything to add.
Omar, you're either thinking or muted.
Sorry, no, I do not have anything to add to what the board secretary has just stated.
Okay, perfect. Thank you very much, Omar, and thank you, Deanne. So I'm going to, for the purposes of the line-by-line vote, then I'm going to turn the meeting over to the vice chair at this point.
Okay, so I will actually call on member El Shantiri to introduce the motion.
Thank you, Madam Vice Chair. That the Board of Health for the City of Ottawa Unit 3 approve the 2021 draft operating budget for the Ottawa Board of Health, outlining at document 1 as follows. A, page 5, Ministry of Health and Long-Term Care Programs and Standards. 1, COVID-19 base. 2,
can I just hold you there, member Ashton? Do we need to vote on each line that we carry? Or can we introduce the whole motion?
I thought to introduce the whole motion.
Yes, please vote on each line.
Okay.
Thank you.
So we'll pause there after COVID-19 base. Is that carried?
Carried.
Okay.
Carried.
2, cost share core program.
Carried.
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 Ontario Senior Dental Care Program.
Carried.
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 Healthy Baby, Healthy Children.
Carried.
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 100% city programs.
Carried.
Carried.
Miscellaneous program.
Carried.
Carried.
COVID-19 one time and
Carried.
Carried.
B, page 10, user fee.
Carried.
Carried.
Item number 4, upon the Board of Health approval. Oh, okay, so it was gone. I was reading on the screen. Now it's gone. Okay, upon the Board of Health approval of the 2021 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to the Ottawa City Council for consideration on December 9, 2020 as part of the City Council's approval of the City of Ottawa 2021 draft operating and capital budget. And 5, upon approval of the 2021 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the medical officer of health or delegate bracket on behalf of the Board of Health to forward 2021 annual service plan and budget submission to the Ontario Minister of Health for consideration based on approved 2021 operating budget for the Ottawa Board of Health.
Carried.
Carried.
Over to you, Chair Eglai.
Okay, thank you very much, Vice Chair and Member El Shantiri, and all the board members for the unanimous approval of the 2021 budget. And thank you to Dr. Etches and to Lou and her team. Dr. Etches has her hand up. Is there something you'd like to say?
Thank you, Chair. I would really want to recognize the extraordinary work that Lou Flaboria has led to do this, and how he's mentored the team too. So you acknowledged it's a team. It's a small team that works on our budget, but Lou has been with Ottawa Public Health for 4 years, and he's certainly made a difference. He has an attitude of finding a solution. He's certainly very responsible and pays attention to using the funds we receive in the best way possible. I wanted to take a moment to particularly recognize him tonight.
Well said, and I've had many discussions with Lou in the last number of weeks leading up to the budget, and he's always been receptive to suggestions and very flexible in terms of how he and his team approach things. So I echo your sentiment, and a huge thank you to you, Lou, in a very challenging budget year. Our next item is number 5, update next steps on the COVID-19 response. We do not have a presentation on this particular matter, but we do have a public delegation Elizabeth Whitmore, who I believe is on the screen. And I'll turn it over to you, to Elizabeth, and you have 5 minutes to make your presentation. Are you good to go, Elizabeth? I can see a slide, but we can't hear you, Elizabeth.
Got it. There. Now can you hear me?
Absolutely.
Okay. Open, accessible public toilets are an issue for everyone. 100% of the population needs a washroom from time to time. Next slide, please. Exercise and fresh air are essential to maintaining our good health. Everyone agrees on this, and certainly during COVID. Next slide. But where to go when there's no washroom, when we need one? Next slide. Not here. Next slide. Authorized personnel only. Next slide. So finding a public washroom during a pandemic shouldn't be this hard. Next slide, please. Feces are a public health hazard. COVID has been detected in human feces. Studies are beginning to show this. Next slide. Desperate people do desperate things. Parks, alleyways, parking garages, sidewalks, or the bushes become the only option for many. This is an increasing problem in the city. Next slide. Public toilets are an essential public health infrastructure. It's an issue of priorities for the Public Health Board and for the city. In the many reports that I have read, and if I have missed something, please let me know, but I see no mention of public toilets, not in the draft budget, not in Dr. Etch's reports, not in the Community Safety and Wellbeing Plan, the interim report. I don't see any mention of public toilets as an issue, even though we continually talk about public health as being such a priority right now. So we urge the Ottawa Public Health Board to include public toilets in the city budget as essential public health infrastructure. Post-COVID, we're still going to need them. Next slide, please. So you can read that one and the final slide. So I welcome any questions that you may have.
Thank you for the presentation. And again, I will go through the list of board members. Member Banham has had to leave. So Member Cloutier, any questions?
Nothing, thank you.
Thank you. Vice Chair?
No questions, thank you.
Thank you. Member El Shantiri?
No question. Thank you, Mr. Chair.
Member Gower?
No questions, Mr. Chair.
Thank you. Member Kavanaugh?
Thank you very much. And I want to thank the presenter for this because I think she's right, that it's absolutely essential that we look at public bathrooms as an issue. And I know it's awkward during COVID, but it's still very, very necessary. So I want to thank you for that. And I want to ask you about the connection between that and physical activity outside, because we're trying to promote things like trails and things like that, and they go together if you go for walks. Would you agree on that?
Absolutely. Absolutely. We hear a lot from the public about that they plan their walks according to where the public washrooms are or are not.
Yeah. It's funny. I have a story because I went out for a run and I was stuck. And I realized I was too early for all the malls were all closed. And I had to call up my mother-in-law because I happened to be in her neighborhood. But so I was rescued, but it's real. It's very real. And I hope as a city that we consider that in the official plan, because I think that's where it needs to be. Thank you.
Thank you. Member Lakin?
No question, just a thanks for being succinct, articulate, and correct.
Thanks.
Member Menard.
Yes, thanks, Chair Aglai. And thank you very much for being here, Ms. Whitmore, and for all your advocacy. I do have a question for you. I've been watching your work very closely, and we've worked together, of course, on things like bathrooms at Lansdowne and the opening there, and other porta potties necessary on Bank Street. So thank you for all of that. But what is your main ask for this budget? My understanding is there's some pretty easy wins we could do here. Number one is, and it may not be for the Public Health Board, it may be for Council as a whole when we get there, but my understanding is one is around signage, simple signage for where publicly accessible bathrooms are. Are there other asks that you've got that could help in that way?
Yes, in fact, we have sent a letter co-signed by 29 organizations and associations around the city to the City Council. And I assume all of you received that. If you haven't, please let us know. And signage, we have a number of asks, signage being an obvious one. A second one is considering the possibility of a small subsidy to coffee shops and restaurants to allow their toilets to be public. This is done in other jurisdictions. And in fact, many coffee shops are de facto public toilets. How many of us have used Timmy's, for example? And thirdly, there needs to be some strategically placed public toilets in high traffic areas in the city. Those are more expensive, but they can be done, and they're done in cities across Canada and around the world. So if we want to be a livable city, we need to do that.
I agree. Thank you so much for presenting to us here, and I hope we can see some action on some of these simple items you've mentioned that would go a long way to help people. Thank you.
Yeah.
Thank you. Member Pinnell, please.
I also say thanks, Ms. Whitmore, for your presentation and for being here, but no questions. Thanks.
Thank you. And Member Tilley.
Oh, just a great reminder. Thank you for something we wouldn't want to overlook.
Thank you. And thank the delegation for her presentation. Can we receive this report, please? Thank you. We've dealt with the additional item. So we will move then on to...
we can move to the motion to adopt reports, Chair.
That's where I'm going right now. To I was going to say Councillor, not Councillor tonight, but Member El-Shantiri.
Thank you, Mr. Chair. Be it resolved that the presentation on the City of Ottawa draft official plan, the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled 2021 Draft Operating Budget for the Ottawa Board of Health, Update and Step on COVID-19 Response, Ontario Public Health Standards, 2020 Activities Report, Risk Management, and appointment of an Associate Medical Officer of Health in camera, which we didn't do that in camera, personal matter about an identifiable individual, reporting, outdate, upcoming council approval, be received and adopted.
Is that carried?
Okay.
Carried, thank you. Are there any motions requiring suspension of the rules of civil procedure, or procedure rather? No, thank you. Are there any notice of motion for consideration at a subsequent meeting? No, thank you. Back to you, Member El-Shantiri, for the confirmation bylaw.
Be it resolved that confirmation bylaw number 2020-6 of bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceeding of the Ottawa Board of Health at this meeting of November 30th, 2020 be read and pass.
Carried.
Okay.
Are there any inquiries? Thank you.
I We
Yes.
don't have that motion, but I would imagine I can make that up. So be it resolved that the Board of Health of the City of Ottawa be adjourned.
Thank you very much. Our next regular meeting will be Monday, February the 8th, 2021. Before we close, just want to remind any media who may be watching this meeting on the YouTube live stream that we will have a Zoom media availability 15 minutes after adjournment. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. And thank you all very much. And we won't have the opportunity before the end of the year, so Merry Christmas to all. And then hopefully we're going to have a much better new year than 2020. I'm hopeful for 2021, and I wish you all well. Thank you.
Happy New Year, everyone. Happy holidays, everyone.
Happy holidays, Merry Christmas, and all that. Bye-bye.
Bye-bye.
Merry Christmas.